Good evening. My name is Jerry Newman, and I am presenting this final project for the Introduction to Healthcare Informatics class this December 21st, 2017. My project is entitled Informatics and Asthma, a Proposed Approach. Respiratory diseases represent a global issue. In treatment terms, you are treating a respiratory disease either in the moment or as an acute episode or as a chronic care, which means long-term or tends to be over the life. Both methods of treatment represent a large amount of funds spent on care. However, the nature of chronic illnesses indicates that the lifetime of the disease will produce a much larger volume of funds spent in caring for the illness. Chronic respiratory diseases share similar symptoms, which can make it hard sometimes to actually identify which respiratory illness they are. These symptoms can include shortness of breath, wheezing, coughing, fatigue, and anxiety. Asthma is considered to be one of the top 5 chronic respiratory diseases globally. 2014 data estimates showed that over 334 million people globally have asthma, and that the prevalence rate in low and middle income countries is growing. That does not mean that we don't have this illness in high countries, but that the predominance and the growth of new illnesses is not growing in the same levels as it is in low and middle income countries. Asthma is the most common chronic disease in children, and more than half of patients with asthma experienced an attack in the previous 12 months. This experiencing of attacks actually impacts work and school attendance, which also impacts productivity, education, and many other factors of living. Less than half of all patients that have asthma know how to manage their illness properly. Asthma cannot be cured. It can be managed though, and a successful management program requires that an early diagnosis be made, that long-term control of the illness be established, that patients are able to self-guide and manage their illness and exacerbations, and that effective education programs are in place both for the patient and the providers to ensure that the disease is being diagnosed correctly and timely. Although asthma tends to be identified in an emergency situation and diagnosed and initial treatment started in that circumstance, there are established best practices in ongoing treatment and initial treatment of asthma. And this treatment, these best standards actually primarily include the use of corticosteroids, but it does involve testing, a variety of pulmonary function tests, such as peak flow monitoring and spirometry to determine actual lung capacity and fail points in breathing issues, but also to do allergen testing to determine potential environmental, chemical, and other allergen factors that can come in conjunction with asthma and can exacerbate asthma symptoms. And then the final best practice has to do with education. The education of the patient as to what actually can trigger their asthma, as to how to deal with when those triggers happen, and as to how to properly utilize their medications. Therein lies the problem, the educating the patients on their illness, health literacy. That is the problem. Over half of Americans do not have the basic skills to be able to read and understand materials. And while diagnosis and initiation of treatment tends to start in the emergency room, there is such a wide range of potential triggers to identify and excessive amounts of information to go with each of those that it compounds the issue of understanding the disease. Issues like allergens can be allergies to food or to animals or to smells or to other environmental factors such as mold or mildew. It can be caused by chemicals, sometimes chemical inhalation, sometimes an actual true allergy to a component of a chemical. It can be weather related. Temperature and humidity factors can actually impact the way a patient responds with asthma. Obesity and other health-related issues, such as cardiology issues, can also trigger issues with asthma. While adults are identified with asthma, and many have been treated for many years for that, there's a growing number of children that are diagnosed with asthma, which compounds the issue of being able to treat and have adequate health literacy with regards to asthma, because the education has to be for both the parent and the child. And in many instances, the child may have asthma, whereas the parents do not. And so education requires being able to have the parents understand that there are modifications to life that may need to be conducted. Large volumes of materials and electronic sources are available through the internet, as well as in print documentation. But again, with almost half the Americans lacking the reading skills and language barriers that impact other diverse groups, it is really difficult to be able to efficiently spread a message on a very detailed disease such as asthma. Effective treatment and care of asthma really centers around self-management and long-term control. And to be able to have both of those factors effective in your life, an asthma patient needs to be able to have recognition of the triggers and the ability to modify their behaviors, as well as an ability to effectively communicate the symptoms that they are experiencing in a timely manner in a two-way communication standard, whether it's with a nurse or with a parent or with an educator or with a provider. While medical interventions such as inhalers for asthma patients, along with the various testing devices, have existed for a while with minimal changes in the way those services are provided, currently the new push in health literacy and information involves the internet. There's a wealth of websites and materials available out there that express various information on the disease and on the triggers that can happen, as well as the various ways the body can react. Wearable devices that exist in the commercial marketplace can help monitor health data and events and actually help educate patients as they go along by making them aware in very simple terms of what is actually going on in their bodies. Mobile technology, of course, exists, and smartphones are used for communications and connectivity globally. And these smartphones now have apps to be able to document and access information related to the particular events in an asthma attack. Despite the availability of wearables and the accessibility of apps and software, as well as internet connections through smartphones and mobile technology, there is still a lacking need for an all-in-one device for asthma patients. And what I propose is a concept of a wearable device, something that utilizes a Fitbit platform where there's current health data elements and data collection and reporting tools, such as the software that can be used on both mobile devices and on desktop computers, and the ability to communicate that information, along with the concept that the wearable device has a unique ID and single user registration protocols, which ensure that your information does not get into somebody else's hands. And combine that with a current asthma wearable that is being tested by North Carolina State University, which is designed specifically for asthma and collects various environmental data such as temperature and humidity, ozone concentrations, expiratory and wheezing rates through add-on pieces that collect those data, and GPS location, just like a Fitbit does. The data collected by these devices would then be monitored against established norms, and if a deviation occurs, it is able to push notifications to inform patients to monitor their individual activities. It can even offer suggestions as to what a patient may do to actually bring their levels back in norms. Provides direct access to educational information through SMS texting or again push notifications with links that can lead to a connected service, and also offers the option to contact their healthcare provider or link to an on-call service such as a triage RN service. This data can then be logged and then transmitted directly to the provider for entry and review. This allows the provider then to modify care plans as well as monitor and improve health literacy of the patient and their family. Because we are dealing with patient information here and data that is being collected, there are some things to consider, and one is standards and terminology. There are best practice standards, and there are standard protocols and treatments that need to be done. However, there will still need to be information collected and observed on which standards actually need to be monitored and will provide ongoing information. And there is a need to create standardized infographics that will be utilized for this specialized data collection. As a privacy and security issues, while wearables contain unique IDs with individual registrations, there is concern that if somebody were to resell the device, they might forget to clear the data and their information can be passed on to something else. However, there's less concern in this because the specificity of the disease management device should reduce the resale of this wearable. Lost devices, however, could pose a security issue, not necessarily in the wearable itself, but if the smartphone or mobile tech that the software is linked to is actually retrieved and does not have any kind of lock mechanisms on it. However, patients do consent in their sign-up process for collection and transmission of the data, and through the course of their actions, they are actually able to authorize ongoing, transmission of the data when relevant to their providers. While implementation is never simple for something like this, the fact that some of these devices are already available does promote a quicker implementation period. Implementation would include establishing partnerships between the wearable device owners, creating the appropriate infographics so that the measures can be seen and understood from the devices, and modifying the software to expand the collection of the data. Further partnering with other services to collect and link data such as weather conditions, as well as asthma-specific devices such as the spirometers and GPS-tracked inhalers, can inhibit certain factors being able to move forward. We will also need to be able to partner with a very specific site such as WebMD or the Asthma and Immunology Association to be able to provide clear, precise, understandable information. And further, there will need to be partnering within the software to be able to actually access and link to text or make phone call connections to providers, or possibly even use video services for potential telehealth connections. Ongoing monitoring of the success can be assessed by the data that is collected, both for patient care as well as research opportunities. By assessing this information and monitoring what is going on with the patient, you are able to determine that health outcomes have improved, and through increased medical adherence, better self-management, decreased medication use, quicker identification of triggers, and behavior modifications of the patients and their families. Further assessing the effectiveness of asthma treatment through this wearable device and consumer health informatics technology is demonstrated by improving health literacy. The more we understand about the disease, the more we understand about our individual reactions, the more we can reduce the impact of this disease. It means that we can better manage our own issues and our own problems and improve long-term control. We're more apt to go to the doctor and follow their advice when we understand what is going on with our disease and with our issues. And in the end, we have improved quality of life, which is really important given the fact that asthma is impacting more and more people every day. And as our country grows, as our world grows, and as increasing numbers of people live in low and middle income countries, not just the United States, but all over the place. Over 334 million people currently need care, and the way to reach them is through the devices that they currently use that can mean the difference between a good quality of life and a constant burden of financial and health burden related to asthma. Thank you very much for your time and for listening to my proposal on how to better care for asthma and asthma patients through current and future developed consumer health technologies.